The piece argues that parental alienation is incorrectly treated as a private family dispute, when in reality it functions like a public health issue with broad societal impact. 1. Why it fits the public health framework. The article states that public health problems share three traits. They affect large numbers of people, they cause predictable and measurable harm, and they create long-term social and economic costs. Parental alienation is said to meet all three. Many children of divorce encounter it. It produces identifiable psychological injury, and the effects can burden mental health, education, social services, and justice systems. 2. Psychological harm to children. The text emphasizes that alienation disrupts crucial developmental processes. Attachment. Children lose a bond with a loving parent, leading to abandonment feelings. Identity. Rejecting half of one's family creates internal confusion. Emotional regulation. Chronic stress from loyalty pressures increases anxiety and mood issues. The harm often manifests later in adolescence or adulthood through depression, substance misuse, and relational problems. 3. Lifelong and intergenerational effects. Alienated children who become adults may enter therapy more often, struggle with intimacy and trust, and risk passing similar emotional patterns to their own children. This turns alienation into a multi-generational phenomenon rather than a one-time incident. 4. Why society downplays it. The article explains that alienation hides in plain sight because it leaves no visible injuries, it develops progressively. Institutions defer responsibility, and courts frame it as a conflict instead of psychological harm. Delayed intervention makes treatment more difficult and expensive. 5. Mental health services, social services and child welfare. Schools, due to academic and behavioral impacts, and the justice system, through ongoing conflict and litigation. These cumulative burdens support the argument that society at large is affected. 6. Recommended policy shift. The article calls for reframing the issue through early detection in schools, healthcare and social services, coordinated intervention across professional sectors, child-centered policymaking, and improved professional training for legal and mental health fields. The conclusion stresses that recognizing parental alienation as a preventable public health matter would enable earlier and more effective protection for children, reducing long-term social costs.